Hi guys, good morning once again, and of course it's a good one to have you guys again on the show today. It's Saturday, and for those who be family members, you don't know, say every Saturday from 8:30 to 9:30, Dr. Bat and myself, they always stay in the studio. I'll talk about everything we guys do with health. But for a while now, no, me and Chief guys do our calculations today. We're like, okay, fine, we've been talking about coronavirus for how long? And we've been finding out since 2019. As a matter of fact, WAPT was one of the channels, the first channel to start talking about it. And that's why it don't win us so many awards, because of the good work we did do, of course. So, create awareness on top of the pandemic, tell you guys things you need to know, tell you what you need to stay off. And definitely, when you have an expert in that field, it can only get better from there, right? Okay, so ladies and gentlemen, it's another day, and Dr. Bat is looking all ready for you guys. As always, maxed up, looking good, pengy.
Good morning. Nice to be with you.
Yeah, as always. Good morning, sir.
Yeah, good morning, viewers at home and around the world. We're happy to be back today to talk about the all-important topic, to give us updates on what we need to know about the current situation of things.
Yes, so
globally, in Africa, as well as, of course, our own dear country, Nigeria. It is no longer news that the world is witnessing what is regarded as second wave in some countries of the world of COVID-19. We now have cases rising astronomically, not just globally, even in Africa. CDC was talking about the fatality rate in Africa that was previously at about 2.1% sometime in July last year, but has today jumped to 2.5%, talking about the number of people dying. Fatality rate actually talks about the number of people dying per 100,000 in any population. Okay, we'll look at all of that, as well as the updates we have with respect to vaccine. It is also no longer news that because of the emergence of a number of new variants, COVID-19 has become a lot more contagious. The transmissibility has increased from what it used to be. And of course, what that translates to is that a lot more people will get infected if they fail to adhere strictly to public health measures of prevention or of mitigating against COVID-19, which of course we all know by now. This includes ensuring that we wash our hands at all times under running water with soap. And of course, where that is not possible, we must have to use hand rub or sanitizers to sanitize our hands. And as well as maintain social distancing between one person to another. Not just maintaining social distancing, we should also avoid crowded places at all times. Avoid mass gatherings. In the course of today's presentation, we are going to look at the recently law that was made in Nigeria by, of course, our head of state, President Muhammadu Buhari. Okay, now that law was called Coronavirus Disease COVID-19 Health Protection Regulation 2021. Coronavirus disease, in bracket COVID-19 Health Protection Regulation 2021. And of course, a whole lot were said in that document. I think it ranged from part 1 to about 6. And now it is an offense for anybody in Nigeria not to keep to the mask mandate that was recently enshrined.
Yeah, I'm still seeing people without their masks. So.
It's now an offense, and of course, someone can go to jail for disobeying such a government directive. We need to know about that. Now, talking about the variants that have emerged. Last week, or about a fortnight ago, we did talk about different variants of COVID-19 that are far becoming the dominant variants that are circulating in the population. Of course, top among them is the UK variant, as well as the South African variant, and of course, the Brazilian variant. Those are the notorious ones. But recently, a study came out and said that in reality, that we have over 4,000 variants of COVID-19 circulating in the population. That number is frightening.
Very.
Yes. But now we have spoken about those variants before. Now, it is a natural thing for viruses to mutate over a period of time. Some of those mutations may just fizzle out without causing much problem to the population. A few of them may actually react differently, okay, in the sense that they may become more pathogenic. Talking about the disease-causing strength of such a variant, pathogenicity of such a variant, it may become much more deadlier than what we currently know. And of course, the global community is concerned, the scientific community is concerned because of a number of factors, one of which is the fact that the currently available vaccines, which probably did not factor into take cognizance of the fact that there were going to be variants along the line, are the currently available vaccine candidates that are being used today, will they be able to capture, will they be able to protect against these variants? Is a question that have not been completely answered at the moment. Apart from that, the diagnostic apparatus or test kits that are currently available or that are in use at the moment, will they still be effective with respect to these variants? These variants per se, are they likely to be more deadly than what we have seen? These are many questions what the scientific community will need to tackle in the next coming weeks to months, and of course years. And I can tell you that they are rising up to the challenge. I can tell you that a number of pharma companies have actually started working on the next generation COVID-19 vaccine. Okay, GSK, GlaxoSmithKline, GSK, in line with Germany's QVAC, okay, they've mapped out $180 million to go into a form of partnership to develop the next COVID-19 vaccine that can actually cover the variants. Receiving a jab can protect you against all sorts of variants, which of course was not seen at the time these vaccines were coming out, because they were more or less rushed. Ordinarily, vaccines will take years, many years, okay, before they can get produced. The earliest we have seen before now was a vaccine that was produced, I think, within the space of 4 years. But you can agree with me that tremendous efforts were made when this COVID-19 started about 2 years now. It's already 2 years.
Yeah, it's already 2 years. Already 2 years, 2019.
Within a space of 12 calendar months, the world witnessed a massive, groundbreaking achievement in the sense that vaccines were produced in so short a period of time. And we weren't expecting that such vaccines would be anything very effective. And of course, I can tell you that a good number of them are very effective today. Talking about the leading vaccine candidates, we just have to mention some of them. Number one is the Pfizer-BioNTech vaccine candidate, currently topping the table. And of course, we have the Moderna vaccine candidate, and then you have the Russian Sputnik 5, okay? And there's a lot of collaboration that are happening between these vaccine producers. I can tell you that Sputnik, that's talking about the Russian vaccine candidate that was produced by Gamaleya, okay, Health Institute in Russia. They recently entered into an unprecedented partnership with AstraZeneca, as well as Oxford University researchers, to produce to see if they can work on a single vaccine that will be a lot more efficacious than their individual vaccine candidates that they've been able to produce as of the moment. And I can tell you, as of today, what we have with respect to vaccine updates, 40 vaccine candidates are still in phase 1. Phase 2 has about 24 vaccine candidates, while we have about 20 at the final stage. That's talking about phase 3, clinical trial stage. And about 8 of those vaccine candidates have gotten limited approval. About 8 of them have gotten limited approval. Okay. Yes. Now, three, as of February 3rd, have gotten approval, formal approval, while four have been abandoned. Four vaccine uh, candidates were abandoned as a
Already
result.
abandoned.
Usually, one of the earliest that was abandoned was the vaccine, those volunteers that came out to be used for the trials. They were discovered to have developed HIV, even when in reality they didn't have HIV as a result of the vaccine that were given to them. Okay, so when they encounter some challenges that are not compatible, yes, or that can be life-threatening, sometimes it may lead to such a vaccine becoming abandoned along the line. Okay, one of the vaccines also has received
Commendations.
no, not commendation. WHO approval of, they called it emergency use listing for the moment, and of course that is Pfizer BioNTech vaccine candidate. WHO has given that particular vaccine candidate emergency authorization listing. Okay.
Okay.
So that's a good one, and of course we do know that as it stands today, 65% of all the people that have been inoculated can be found in the developed wealthy nations of the world. So,
Wealthy nations of the
yes,
world. It's okay.
There's a great deal of inequality going on at the moment with respect to distribution. South Africa, I think about a few days ago, took delivery of about 1 million doses of one particular vaccine. We're expecting any moment from now.
Okay, doctor, I think we'll just pick up from that because we need to go for a quick break. If only we could make that a pledge, individually, saying, okay, COVID go stop with me. I go make sure, say, I no transfer, I no transmit this thing to another person. Because the truth is, the government is actually trying, whether we like it or not. Every day they try to bring, new measures and all of that. But then, are we obeying as citizens? For me, I would say a no, because I still see people without their masks. I see they see people, they so clustered up in some places. You enter markets, you see some persons without their masks. You see them so choked up and all of that. When you try to call their attention to that, they make you feel bad. They make you feel some type of way. But like they don't talk individually, you have to fight this together. It has to stop with me. It has to stop with you. I need to go out with my masks and all of that. For now, we say no to kissing. Like, especially if it's not your husband, you can't trust the person, you don't know the health condition of the person. For now, we say no to hugging. And obviously for schools, we don't resume with the appeal to proprietors, with the appeal to proprietors, teachers, parents, and all of that, to do everything needful to make sure, say, your school day in a very good condition so that we all fight this thing to the last, all right? Because before that break, I actually asked doctor, they be tell us in our January ending. A couple of persons, when they put their mind on it, say, okay, the vaccine is coming. I have made up my mind to take it. But then January came, you know, hear anything. Now we are in February. As a matter of fact, today is 6. And we never still hear anything about the vaccine. So maybe doctor would have an answer to that, because definitely I'm going to be asking him that. He said, in his word, Dr. Fred went on that break. We were just saying, a couple of days back, they don't bring South Africans on, right?
Yes.
Yeah, so now we are expecting, because it's okay for them to say, if you don't wear your mask, you go to jail, blah, 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 and all of that. Yeah, that's a very good one. But then the vaccine that we've been promised, because now some persons have actually have this open mindset, okay, let me just take it. Let me take it if it comes, I want to take it. But now, it is no longer, okay, maybe it's still coming, but what's delaying it, doctor, or do we have it yet?
Thank you very much. Well, before I go to the question of vaccine, I also want to add my voice to what you have said with respect to wearing of face mask. Okay, you mentioned schools and some other places. I also think leaders of faith-based organizations should also play a significant role along this line. Community leaders should also do their part. They need to educate their subjects on the importance of adhering strictly to COVID-19 protection protocol. Of course, top on the list is wearing of face mask, washing of our hands, alongside other measures. Okay, so we need to, it's a collective responsibility. We need to encourage each other. We need to encourage one another. Okay, federal government has done their own by putting their leg down, by putting out a law that all of us must follow. It's not just about getting people arrested on account of that, but I also think that should also help. When these things are enforced by law enforcement agents, everybody will have to sit up because we need to protect each other. Getting infected is a no-no because if you're in doubt, take a walk to some of the isolation centers that are still in operation in Nigeria. IDA Shaba is there. We recently we saw a video that were released, video clips that were released from there, where the Honorable Commissioner of Health for Lagos State, Professor Aki Abayomi, workaholic Aki Abayomi, was talking about the number of cylinders of oxygen that they use per night.
Yes,
massive oxygen. And I can tell you today that oxygen are in short supply. People are struggling to get oxygen. It's everywhere, not globally, not just in Nigeria. Okay, so the only way to stay protected,
and this is not cheap,
yes, is to avoid getting infected. Prevention, they say, is better than cure. Okay, it's better to do over syllables than to
not to even do
to be under ventilator. If you've seen people who have gone through these experiences and they share what they saw, you will understand. Time was when people were asking us, Doctor Slimity, have you guys seen anyone that was infected?
It's no longer eating now because obviously we get to see videos. We get to some media houses actually go there to cover. At least I know of some government stations that had to go to different isolation centers to interview those persons that have been infected. So we have evidences around.
So our phone lines are open for viewers at home. If you want to put a call to us, we're here to treat your question or your contribution. Okay, now, before I tackle her question, I want to talk about the fact that NCDC, in conjunction with the Federal Ministry of Health, they've actually come up with COVID-19 Patients Handbook for Home-Based Care in Nigeria. COVID-19 Patients Handbook for Home-Based Care in Nigeria. Okay, and it has a number of contents. I will advise that each and every one of us can actually get it and share with our friends, our family members. Everybody must be aware of it. Okay, so we can see the link that is currently being displayed on our screen. Okay, among the contents that I have here, I think that should be page 1, if I'm not mistaken. What is coronavirus disease? What is home-based care? What is home-based isolation? Why home-based care, isolation, and care? Who is eligible for home-based care? Who is not eligible for home-based care? It's not for everybody. Some infected individuals may be eligible for home-based care, while some others may not be eligible for that. All of these are contained in this handbook. What medicines can be used during home-based care is also no longer news. There are a lot of drugs are being abused today in Nigeria. People are taking all sorts of drugs, even for some of the drugs that are still undergoing trials. Okay, once they hear that they are getting good results, everybody will switch over and then ensure that there is no one to be blamed, actually, because everybody wants to survive. So it's difficult to put blame on anybody's doorstep, okay? But yes, you need to look at this home-based handbook, okay? It will help us to answer some of those questions. What should be done if symptoms worsens, okay? Let me read out what I have here. What is home-based care? This is when a patient confirmed to have COVID-19 by a lab test is provided with required medical care at home. Care is provided by an assigned caregiver who may be a family member, a friend, or an identified person. The support to those patients must be based on advice and support from designated and trained health workers. The patient and caregiver should strictly follow the home-based isolation criteria and other COVID-19 infection infection prevention and control measures contained in this document. Home-based care is only recommended after A. Appropriate risk assessment has been carried out by the State Ministry of Health. B. Adequate counseling and patient information have been given by a clinician from the state management team. Home-based care is only recommended for patients who do not have symptoms of the disease, asymptomatic patients, or those that have only mild symptoms such as headache, fever, or fatigue. They also defined what home-based isolation is. What is home-based isolation? This is when a patient confirmed to have COVID by a lab test is mandated to restrict activities and movement to a room in their home. In households where more than one family member is confirmed to have tested positive for COVID-19, it is advisable that family members from cohorts within the household to limit the risk of infection during the entire period of home-based isolation. The patient is required to A. Refrain from going to public places such as workplaces, schools, markets, churches, mosques, meetings, etc. Avoid using public transport like buses, taxis, and others. Avoid direct contact with every member of the household. The sharing of rooms, bathrooms, feeding utensils, clothes, and others must be avoided. The patient must have a caregiver at home who provides support, but should not come in direct contact with the patient without wearing a face mask. In this situation, a medical face mask is advised and gloves. Okay, so let me talk about eligibility. Who is eligible for home-based care? Eligibility for home-based care will be determined by a healthcare worker. Okay. The criteria include A. Any patient below 60 years old who is clinically stable, no history of a non-communicable disease, and AI, asymptomatic or mild symptoms, AII, normal oxygen saturation, SpO2 greater than 95% on room temperature, on room air, has available space for optimal safe isolation. The space must be adequate. B. Any patient discharged from treatment centers for home care. This is to allow them to complete their isolation period. Who is not eligible for home-based care? I think we need to mention the people who are not eligible. The following patients are not eligible for home-based care management. A. Patients with all age, within all age, who present with moderate or severe symptoms such as breathlessness, high-grade fever, fever greater than 38 degrees centigrade, that is not abating over a period of time, and extreme fatigue. B. Patients with significant comorbidities, e.g., poorly controlled hypertension, diabetes, asthma, other chronic heart, kidney, liver, or lung disease, obesity, etc. C. Patients who lack adequate self-isolation facilities, e.g., inadequate home accommodation. People in face me, I face you may not be able to participate in this type of treatment plan. D. Pregnant women. Pregnant women should not be managed at home. They are not eligible for home-based care. Earlier in the week, I got a call from a friend who was asking me that she stays opposite a pregnant woman that has COVID, that was infected. And I was wondering why she should be at home alongside other family members. Okay, so if you're pregnant and you have COVID, please know today that you're not eligible to be managed at home. Of course, the person was calling me to get one or two medical information on what the woman should do and what she ought not to do. Such a person should contact the state, to call the state hotlines. And of course, they will direct the person on appropriate measures to take, not to remain at home. Who is not eligible for home-based care? Number E, any high-risk patient based on a clinical risk assessment done by a healthcare worker. F, elderly patients, 60 years and above, who do not meet the criteria for home-based care. So you can find this and many more on the handbook. I just read this one that I think we should know.
Should know.
Yes, we should know of.
If it's online, is it online? Yes,
it's online. You can download it. The link was shown to us a while ago.
MCR, please, can you guys put the link up again so that people who watch us for go fit copy and obviously download it after the show and then
share with their loved ones.
Yeah, please share. Once you have it, you can share the link. I'm sure you should be able to share.
Okay, so remind me of your question.
Yes, I said I was asking Doctor. You talked about South Africans receiving.
Okay, yes.
So why don't you have ours yet? What's delaying
it? Let me answer as a medical professional. I'm not holding brief for the government officials though. Okay, so but as a medical professional, I do know that the vaccines we are talking about are vaccines that need super cold temperature for storage. The logistics must be in place before you can think of bringing in such vaccines. For instance, the Pfizer-BioNTech vaccine candidates cannot be stored in our normal refrigerators. Neither can we store them in our normal deep freezers. So Pfizer-BioNTech, they've developed their own special storage facilities that can be taken from one place to another. Okay. So I think each country will be expected to upgrade their storage facilities for such vaccines before they can be brought in. Otherwise, it could become useless.
I thought we had that planned out.
Yes, I think earlier in the week, Dr. Faisal Shuaib actually said Nigeria was ready. Our storage facilities have been updated and upgraded, and we are ready to receive ours. And I do know that any moment from now, we should be having our own stock coming into Nigeria. Like I said before, if it comes, I'll be among the first healthcare practitioners.
But funny enough, Doctor, you are ready to receive, but I've had a couple of persons. Now, that was I actually wanted to ask my second question, which is, does how long it take a vaccine to get ready determine how effective the vaccine is going to be? Because you said that on a norm, it takes like 4 years to get or to make a vaccine, right? But now this one was done in the space of 2 years. So some persons are scared that
of 1 year.
1 year.
Yes.
So that fear for some people, because if you say that was just too fast for us to get, like, how trusted or effective is this going to be? Like, I do not want anything that will harm me. So some people already don't get that registered mindset now that this was just too fast for it to be ready. So for me, it's going to be a no-no. So now, does it really matter how long it takes to make a vaccine to determine how effective the vaccine is going to be?
Thank you very much for that question. It's a very important one, and I think the best I can do is to use an analogy to answer the question. Now, imagine having a house, a 4-story building, built already with the skeleton up and, of course, a roof over the building. No finishing yet, no plastering, no windows, no doors. Okay? That was the state of vaccine production prior to the emergence of this COVID-19.
Okay.
So they already have things in place. Okay. For instance, messenger RNA-based vaccines, they've made some attempts in time past to produce such vaccines in time past. So they already have the more or less the point I'm trying to make is that 60 to 70% of the work was actually done prior to the emergence of COVID-19 pandemic. So what it took them was to just probably finish up the remaining 30%. And of course, that was possible because of the tremendous support they were able to get or that they got from a number of governments. Donald Trump, while he was president, doled out huge amount of millions of dollars to them. Some of the pharma companies receive as much as $100 billion for this vaccine production. So that helped to do what? To fast forward and then fast track the processes that are required. Don't forget, I said in the course of along the line when we started that the earliest we have seen a vaccine produced was the one that was done within a space of 4 years, and that was mumps vaccine some years ago. It came out within a space of 4 years. Okay, they didn't have the type of support. Okay, and then of course there was a lot of partnership. For instance, Pfizer-BioNTech. BioNTech was a German company that initiated their vaccine journey early in January 2020. But along the line, I think about March or thereabout, Pfizer had to partner with Pfizer. Okay, so there were a lot of anastomosis of knowledge of scientific tools and what have you to ensure that vaccine was gotten on a record time. Moderna candidate 2 partnered with National Institute of Health in the US. So you can see a lot of synergy between pharma companies to ensure that vaccine was gotten on a record time. So yes, it's unprecedented that they were able to meet up. Okay, but some of the work
had been on ground before now.
Some of the works were on ground before the emergence of this pandemic. And as we are talking, the new set of a new generation vaccine, they've started work. Already. The ones that will be capable of taking care of the variants, no matter where the variant is coming from. Okay, so I understand people's hesitancy when it comes to taking vaccine. But what we should know is that we should trust science. We have seen many leaders in the US coming out in the open to take the vaccine.
Yes.
And they've not died.
At least we saw the president.
Yes. And of course, Prof was telling us that you should expect to see some side effects that may not be life-threatening. Even if there are ones that are life-threatening, they are usually rare. Okay? The ones that could be life-threatening. And of course, vaccine production is a process that is ongoing, that will be ongoing for a long period of time. They will keep making changes. They will keep advancing from what they have on ground. So that shouldn't be any reason why anybody should be doubting the efficacy of such vaccine. To have a vaccine that is over 50% in terms of efficacy is an achievement. But we are talking about vaccines that a good number of them scaled up to 90% and above, 95, 92. That was a massive achievement.
Okay, so doctor just said everything. You guys don't need to be scared.
You don't need to entertain any fear about the vaccine.
Any form of fear. Anyways, doctor, we have very few minutes for you.
Yes. I think it's important to look at the recently made law. Okay, talking about the coronavirus disease health protection regulations 2021. I want to read 1 or 2 pages here. In the exercise of the powers conferred upon me, not me, upon PMB. Yes, upon PMB, by Section 4 of the Quarantine Act, Cap Q2 laws of the Federal Republic of Nigeria 2010, and all other powers enabling me in that behalf, and in consideration of the urgent need to protect the health and well-being of all Nigerians in the face of the widespread and rising numbers of COVID-19 cases in Nigeria, I, Muhammad Buhari, President of the Federal Republic of Nigeria, hereby make the following regulations.
Okay.
Part 1, restrictions on gatherings. At all gatherings, a physical distance of at least 2 meters shall be maintained at all times between persons. That's 1. 2, notwithstanding the provision of Regulation 1, no gathering of more than 50 persons shall hold in an enclosed space, except for religious purposes, in which case the gathering shall not exceed 50% capacity of the space. 3, all persons in public gatherings, whether in an enclosed or open spaces, shall adhere to the provisions of Part 2 of these regulations. The provisions of these regulations may be varied by guidelines and protocols as may be issued from time to time. Let's quickly see Part 2. By the Presidential Task Force, PTF, on COVID-19 on the recommendation of the Nigerian Center for Disease Control. Part 2. Markets, including open markets, malls, supermarkets, shops, restaurants, hotels, event centers, gardens, leisure parks, recreation centers, motor parks, fitness centers, etc. No person shall be allowed within the premises of a market, mall, supermarket, shop, restaurant, hotels, event centers, gardens, leisure parks, fitness centers, or any other similar establishment, hereafter collectively referred to as establishment, except such a person must, okay? A, he is wearing a face covering that covers the nose and the mouth. B, he washes his hands or clean the hands using hand sanitizer approved by the National Agency for Food and Drug, that's NAFDAC. His body temperature must be checked. Any establishment occupier shall make provision for regular hand hygiene for any person coming into the premises.
Anyways, I'm sure all of these things will be on the site.
So guys, on that note, we'll be calling it a day.
Yeah. Thank you guys for watching.
Do not say you're not told.
Yes, so information is key.